All right, I want to bring in our medical expert, Dr. David Winter from Baylor Scott White Health. Good morning, Dr. Winter.
Good morning, Tashara. Good to be with you.
Always appreciate you joining us. Triple-demic is a word used to describe a potential surge of 3 viruses this coming season. Doesn't sound too good. What is triple-demic?
Yeah, triple-demic is 3 epidemics in one. We're looking at that's a possibility right now. Influenza, RSV, and also COVID. We're seeing flu cases have doubled in the last week, so they're on the rise. RSV, you just heard, is filling up hospitals already. COVID it's still out there, but it's not increasing quite yet. But we know that the majority of folks have lowered immunity because they hadn't had COVID or they haven't had a vaccine in 6 months. So I'm very concerned we may have a triple-demic this year. New word for me.
Right. What can we do to prepare for this?
Yeah, it's a good question, Tashara. I think this year, more than any other year, we should strongly consider a flu shot. And now is the time to get one. The flu vaccine does work. It diminishes serious illness, keeps you out of the hospital. RSV, there's not much we can do about that. There's no good treatment, but we know that it's spread through the air and through touch. So if your baby is sick, if your youngster is sick, you might want to keep them home. Wash your hands a lot. Masking is not a bad idea with that also. And if it's been more than 6 months since you've had COVID or COVID vaccine, you ought to get this new bivalent COVID vaccine right now.
Okay, we talked about RSV last week, and you just talked a little bit more about it this week. How bad is it right now in North Texas?
Yeah, well, you just heard it's 90% capacity right now. They're about to run out of beds is a real answer to that problem here in Dallas. And it's on the rise. So that's a big concern right now. They're seeing 4 times as many cases this year as they saw last year. We think it's because the kids didn't go to school or daycare as much last year. A lot of people were masking and distancing last year, so there wasn't that interaction. So there's not much what we call collective immunity out there. Most kids, fortunately, do pretty well with this. But if your kid gets very sick, as was just mentioned, if they're short of breath, look like they're dehydrated, lethargic, you better get them to an emergency center or an urgent care center to check them out. I am worried about this RSV epidemic right now, Tashara.
Dr. Winter, what are those kind of just everyday things we can try to do to protect ourselves? I know you said making sure we get certain vaccines, but what are those everyday things that we can try to do?
You know, here's an interesting comparison. So last year, I saw no cases of flu. There were very few in this country. I saw very few common colds. And COVID actually went down because we masked, we distanced, we paid attention to this virus. Now, you don't see much masking going on right now, so that's an issue. We might ought to consider that, particularly in crowds that are indoors. We need to get more vaccines out there and wash our hands more. Those things worked last year very, very well. We're seeing a big surge right now in all these illnesses because we're not doing those things. So it's a very good question. We can help control this if we would just pay more attention to viruses. They love to spread through the air, love to spread through handshakes and hugging and kissing. Be careful who you hug and kiss and who you're around right now.
Okay, another virus that we talked about last week. Any new information on Ebola? Is it still spreading in Africa?
Yeah, the good news there, it's kind of plateaued, not seeing a lot more cases. The exciting news for me is the fact that the death rate is a lot lower than previous pandemics. They're learning how to handle Ebola virus, or maybe it's just less lethal. I'm not sure the real answer to that. The important news is we're seeing no cases here in America, and anyone who's coming from Uganda, they're being screened very, very carefully. So we'll keep an eye on it, but so far it's tapered off there and no cases here. Good news to end on today.
I was just about to say, better news to end on for sure. Dr. Dave Winter, thank you so much for joining us.
Thank you. Good to be with you as always.